Dr. Bill Sabbagh from the Straith Clinic, and today I want to talk to you a little bit about gynecomastia or male breast tissue. A certain percentage of boys as they go through puberty develop breast tissue, and the majority of these boys, the breast tissue does resolve by itself by about age 18 or so. But occasionally you'll be left with breast tissue that hasn't resolved. This can become very embarrassing for kids. They don't like to take their shirts off. And even in men, we see it who just don't like to take their shirts off and have always dealt with this since puberty. Another group another form of breast tissue is basically as a person ages and if they're gaining weight, sometimes it's just extra fat. So the treatment of the two depends on actually the diagnosis. So younger guys who come in or people who have a history of having developed breast tissue through puberty need essentially excision of that. So that's done with an incision on the lower half of the areola, and essentially the breast tissue is removed and the surrounding fat is liposuctioned to kind of contour that. In most people, the skin is elastic enough where it will shrink back. If a person has had significant weight gain and weight loss and has some skin looseness, occasionally skin will need to be removed, but we really save that as a last resort because you have to compare the appearance of just loose skin to the permanent scars that are necessary for removal of the chest skin. If a person doesn't really have a history of having gynecomastia developed during puberty, or if when you're examining them you don't really have any palpable breast tissue, then liposuction can be performed. And again, it's kind of the same thing. The liposuction removes the fat, deflating the area. In most people, the skin will retract adequately and it'll give you an acceptable or a nice result. But if there is any loose skin excision can be performed. I generally think that skin excision, unless it's just very obvious that they're going to have hanging skin, should be reserved for almost a secondary procedure, and the patient should be allowed to have 6 months to a year to have the skin retract and actually look at the appearance and make the decision themselves that the incisions necessary for skin removal will improve the overall result and they'll have a better appearance, let's say in shirts, than the scars that are present. So if you have any questions about that procedure, email or call us, or you can call for an appointment. Thank you.